Welcome back to the Nursing Post podcast, All Nursing All the Time with Ashley and Rosa. In today's episode, we're going to discuss a recent court case in Texas against William George Davis. Our goal is always to inform and to spark conversation.
Doctors take a Hippocratic oath to do no harm, and nurses take the Nightingale Pledge, which is a Hippocratic oath for nurses. And we have all heard about Dr. Kevorkian, the physician that would assist his terminal patients, because he believed in that patient's right to choose how he died. So he was known as the physician assistant suicide doctor. Like, if you hear somebody saying that's a Dr. Kevorkian, it's not like in a good way.
It's not a compliment.
Like, exactly.
Yeah.
If they have made him into a verb instead of a noun, it's not in a positive light. It literally means you just killed your patient and on purpose.
Yes.
So there have been more sinister doctors than him, for sure.
Yeah, at least with this, the patient wanted to die.
Exactly. Like, I don't know if anybody's read about him or watched any movies about him, but all of his patients video recorded this as like their last will and testament and asked him to do this because they were terminally ill and dying. And like I said, the sinister doctors, they're out there and they're killing people in the past, present, and maybe in the future without their patients' knowledge or consent.
Right.
Most recently, there have been several documentaries, television shows, regarding nurses as being angels of mercies. And these nurses are committing patient murders.
Yes.
We all know of them. Like killer nurses, nurses who kill. There's so many more titles out there, so many more movies out there, to the point where there's podcasts about the podcasts or the movies about nurses that murder or nurses who are trying to solve cold case murders. So like, it's a whole thing all in of itself.
It's funny because I've even made the comment like on social media, like what is it between nurses and true crime that we love so much? There's definitely a link.
There is. Even I told you this stuff, I fall asleep to this stuff. It puts me to bed. Which my husband hates it. I get it. Like, I totally get it. But the nurse in me wants to solve it, wants to figure out why they did what they did and how they did it and what happened to them. That's just who I am. So there was a study done, which I was able to look up from the NIH, and I'll have it linked here to our show notes, where the authors conducted an actual search for criminal prosecutions of healthcare providers that actually met the criteria for being labeled, a serial killer or murderer. There was 90 criminal prosecutions. 44 of the 90 were convicted. 45 of them were for serial murders. 4 were for attempted murder. 5 pled guilty to lesser charges. 24 have been indicted and are either waiting for trial or the outcome hasn't been published yet. And then the other 12 prosecutions had a variety of legal outcomes. So, maybe they did an Alford plea or,
manslaughter or something like that.
Yes, or pleaded out or something like that. The main method used is injection.
Makes sense. I hate to say that like that, but
I know, it's so sad, right? Is injection, then suffocation, poisoning, followed by tampering with equipment. Prosecutions were reported from 20 countries, with 40% taking place in the United States.
And I've said it before, and I'm sure I'll say it again, but we really need to get our shit together over here.
Obviously, we need to get our shit together. Nursing personnel comprised 86% of the healthcare providers prosecuted. 12% were physicians and 2% were health professionals. So nurses, like Ashley said, get your shit together.
Yeah, absolutely.
The number of patient deaths that resulted in a murder conviction is 317, and the number of suspicious patient deaths attributed to 54 convicted caregivers is 2,113.
That's crazy. So one of the first things when we had talked about doing this as an episode that kind of popped into my mind is why? What makes nurses want to kill people? I mean, the whole point of being a nurse is to not kill people. The very thing
to do the opposite.
To do the opposite, to heal. And I hate to say this, but many speculate that it was for attention. And I'm like, that's awful. And how does killing somebody give you more attention? So I was like, I don't know. And then others were like, well, it's probably to get rid of difficult patients. And I'm like, well, as a nurse, I know there's no end to difficult patients. So
no, they keep coming.
One professor of forensic psychology states that many doctors kill to feel godlike, like a godlike sense of power, or to experiment, which is crazy, but okay. But nurses are different, and many nurses kill because they feel undervalued. This gives them a sense of power and attention and a sense of control over the system. Like they're able to manipulate how the system is. And the system, I mean the healthcare system.
Mm-hmm.
This is where like a hero syndrome would kick in, or a hero complex, I've even heard it called, where nurses create a problem so that way they can then fix it and be the hero.
Yeah, I know what's wrong.
Yes,
I can fix it. Yes. I know what who this patient, blah, blah, blah.
Or people are like, how did you see that coming? How did you know that was going to happen? It's just like, they just get this sense of, and that may be where they get that attention from.
And that reminds me, like, if you took out the word nurse and put this on a parent, then the whole scenario changes to Munchausen.
Yeah, Munchausen by proxy. Absolutely.
Yes.
And it can really be hard to speculate as to the real reason why nurses or even other healthcare workers would kill. And one professor of criminology at Birmingham City University believes that many don't necessarily enter the field to become an angel of death, but that it's something that progresses over time. And some that have a history of harming others, when they become a nurse and the hospital gives them all this access, then it gives them the perfect opportunity to kill, to give them, again, that sense of power and control. So a lot of profiling going on there with these nurses that want to kill.
Definitely. Like you had mentioned before, which to me just sounds so ridiculous. I think today I'm going to off this patient because they're getting on my nerves, or, they were rude to me, or, you know what I mean? To me, that is crazy.
It is, because it is. It is crazy. Like I said, there's no end of difficult patients. So I don't necessarily see that. I don't know. I don't understand that coming into play, but I'm not a psychologist or a criminologist. So I will leave that to the professionals.
Definitely. That's what they say. How do they say? That's above my pay scale.
Oh yeah, for sure.
So the reason we decided to do this podcast in general was because of the recent case of William George Davis. Even though the crimes were committed basically between June and January. I think it was June 2017 and January of 2018. The verdict has just now came out. And so there were quite a few recent articles and publications. And this is a real thing. This happens even to this day.
Yes.
So it was alleged that William George Davis had murdered 4 patients and seriously debilitated 3 others. He's an RN in Texas. He started his nursing career in March of 2011. He's a husband. He's a father of 2 kids. He was practicing at Christus Trinity Mother Frances Hospital. He worked in the cardiac intensive care unit. Between June of 2017 and January of 2018, 7 patients suddenly experienced the same unforeseen emergencies. These patients presented post-surgically well, like they made it through their surgery, vital signs are stable, patient's stable, everything's at that point what you would consider within the normal limits before they left that operating room.
Right.
While they were on CICU, which is, the cardiac intensive care unit, CICU, the patients started developing their symptoms while they were in recovery. One patient fell into a coma before he passed away. Davis was injecting syringes with air and putting that air into the arteries of his patients, causing profound, inexplicable neurological issues. And 4 of the 7 patients died, and 3 were left, like I said, with permanent debilitating injuries. According to the Washington Post, the hospital placed Davis on an unpaid suspension while the hospital was doing its kind of like quality control, because they began to see like a pattern here. And they wanted to study the pattern, because all of a sudden you had these really successful surgeries and then patients were dying. So of course, this hospital, kudos to you for doing what you were supposed to do, led its own investigation. And what it discovered was that Davis was the only RN that was assigned to CICU. But not only that, he was actually captured on surveillance video entering the patient's rooms, or his co-workers could actually visually witness him coming in and out of these patients' rooms.
That's crazy.
And then I know it's crazy. Like, first of all, how do you not know that your hospital has cameras? And why wouldn't you think that your fellow colleagues and nurses wouldn't speak up? To me, the whole situation is crazy.
It makes me wonder where else he had done this.
Exactly. And so he was fired from the hospital in February of 2018. And I, being the curious / nosy person that I am, was like, I'm going to take a minute to search the Board of Nursing for this man's license. And when I did that, I was a little dumbfounded, and I was surprised, because underneath his name, his date that he became a nurse, it states that his current discipline, like for the series of all of these events, was that he voluntarily surrendered his nursing license to the Texas Board of Nursing on April 26, 2018.
I mean, that should just say revoked.
Because to me, this just says, okay, he just turned it back in. So at any time he can take the test again, do the course again, sit for the NCLEX again, and get his nursing license again. That's what this says to me. It should say revoked, provoked, never to be obtained. but not just in Texas, but like in any state. And that's like a whole episode we could do all in of itself, because a lot of the times people will leave their current state after they've been disciplined and start all over, like a whole new life somewhere else. So when the state picked up the case and charges, because the hospital found that these and thought these were actual murders, the court presses charges. It only took 2 weeks of trial and 1 hour of jury deliberation for the jury to say that Davis was guilty and is being sentenced to the death penalty. The crazy thing is the amount of evidence. They had the eyewitness statement. They had the fact that he was the only SICU nurse assigned to those patients. They had the surveillance camera. And then, of course, after these episodes happened with the patients, doctors would take MRIs or CTs of patients and literally would find a pocket of air in their brain. And that's how they figured out what Davis was doing.
It's funny to me. You've listened to the podcast, the Dr. Death podcast.
Absolutely. Who hasn't?
And it's amazing to me that this hospital picked up on this after 7 incidents, which is great. I'm not knocking the hospital. But had this been a doctor, I wonder if the turnaround would have been so quick.
See, that's why I was like, kudos to this hospital for doing their job. Like, somebody actually in QA was like, this is not right. Like, all of them had case textbook clinical outcomes from their surgery. So it's not from the surgery perspective, it's from recovery. So somebody sat there and took the time to do the math and pinpoint down to the dates, the time, times, the shifts, everything to find this person. And then they're like, here you go, Texas. We have everything wrapped up here in a little nice pile for you. Do what you're supposed to do. And they did. What I have feelings about is about the Texas Board of Nursing. Notification, current
voluntary surrender.
Voluntary. Like, this guy is going to die by lethal injection. I don't know if that's karma.
I heard that. And then I was like, oh, they have the death penalty, which, I mean, I don't know how I feel about that, but then I was like, oh, that's Texas. I'm like, yeah, they're gonna go big or go home. So
yeah, bigger the hair, closer to God. Everything in Texas is big. Yeah. But just the fact that it says voluntary surrender, the fact that it doesn't say that it was restricted or revoked, and the thing is like, I know he was just recently found guilty, but I looked up his licensure literally last night. There was no update. Like, under our state board, you can go and see, what the allegations are and what the resolutions are. You don't see anything other than this notification, current discipline, voluntary surrender, 4/26/2018.
Yeah.
So let's say he didn't get the death penalty and he got, like, I don't know, 25 years, could be paroled in like 15. He could have just packed up his crap, moved to sunny Florida, and started all over again.
Yeah.
And that's some scary shit.
And he might tell people, like, hey, I hadn't been practicing as a nurse. I don't have a nursing license, but, you can go to the board and see where I did have a license, and it says voluntary surrender. Somebody might be like, oh, okay, it was voluntary. It's not like a bad action. Yeah.
That's crazy to me.
There are a couple of red flags that you can look out for. This research was done by Birmingham City University, and it's 22 traits that are considered to be red flags. I do want to preface this by saying that just because you have one of these does not mean anything, because I'm sure at some point through this, somebody will be like, oh, yeah, that's me. The researcher did not state specifically how many needed to be an active trait to be considered concern, but there was some other research that referenced this that stated that if you had 5 or more of these, that it's probably a cause of concern, and that some of the cases that they had followed on people that had become serial killers as nurses had more than 10, had 10 or more. So one of them is they move from one hospital to another. That's pretty self-explanatory. They have secretive or difficult personal relationships. They have a history of mental instability and or depression. If they can predict when somebody is going to die, or if they make odd comments or claims about being jinxed. Likes to talk about death or odd behaviors when somebody dies. They have a higher incidence of death on their shift. Seems inordinately enthused about their skills. Makes inconsistent statements when challenged about a patient's death. Prefers night shift. They think that's because there's less people around. Associated with incidents at other hospitals. Been involved with other criminal activities. Makes colleagues anxious or suspicious. Craves attention. We all know one of those. Tries to prevent others from checking on their patients. Hangs around during investigations of deaths. Has meds in their locker or in their bag or at their home. They've lied about their personal information. They're in possession of books that are specific to serial killers or poison. If they've had disciplinary problems in the past, appears to have a personality disorder, or has a substance abuse problem.
Wow. If that ain't a list, I don't know what is.
Yeah. So it's a lot. But I mean, just because you like night shift doesn't mean that you're going to kill somebody. But you can see when you start adding 5, 6, 7, 8 of these together, some red flags are going to be thrown.
It's definitely a pattern for sure.
And then a lot of research has stated that other nurses know when a nurse isn't right. They if somebody was to come up to them like, oh, that person was killing people, they'd be like, yeah, I wasn't surprised. I got a bad vibe about them. So like other nurses are able to pick up on these traits very quickly, and they're not comfortable around those people. So if you have a whole unit and they're like really uncomfortable with a person, you might want to keep a close eye on them because there's a reason.
Well, you know what? Your gut never lies.
Yes.
It doesn't. That's your instinct. And that's your instinct trying to tell you something. And I'm one of those firm believers that you should listen to the vibe, how to read a room, and, your gut. So as nurses, I did mention that we take a Nightingale pledge, which is our Hippocratic oath. And what it says is this: I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous, and will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession, and will hold in confidence all personal matters committed to my keeping and all family matters coming to my knowledge in the practice of my calling. With loyalty will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care.
You can visit our website, thenursingpostpodcast.com, for show notes and references from today's episode. Subscribe to our podcast on your favorite platform and give us any feedback that you'd like. And you can also find our merch on our website as well. Thanks again for listening to The Nursing Post.